Hello, everyone, and welcome to Mustard Seed Nursing, where we believe that the fear of the Lord is the beginning of all knowledge. All right, so today we're going to be talking about calcium. All right, we're going to be talking about the normal levels for calcium. We're going to be talking about foods that have a lot of calcium in them. And then we're going to be looking at hypocalcemia, then hypercalcemia. Okay. So let's dive right into it. All right. So the normal levels for calcium, normal serum levels is 8.6 to 10.0 milligrams per deciliter. Okay. So 8.6 to 10.0 milligrams per deciliter. When we talk about foods that have a lot of calcium in them, we are going to be talking about cheese, collard greens, milk, sardines, spinach, tofu, rhubarb. Okay, so these are the foods that you're going to see that has a lot of calcium: cheese, collard greens, milk, sardines, spinach, tofu, yogurt, rhubarb. Okay, and of course there are other foods, but this is the short list that I chose to go with. Okay, now let's jump into hypocalcemia. Right now, hypocalcemia means that there is not enough or too little calcium in the blood. All right, so this occurs when the calcium levels are less than 8.6 milligrams per deciliter. All right, now what causes this to happen? Well, several things can cause it. So let's go over some stuff, right? Well, if you're not taking in enough calcium in the GI tract, right? You're not ingesting enough foods with calcium, then you might have low calcium, right? If you are also lactose intolerant, yes, then you might also have a problem. Or if you have a disease like a celiac disease or Crohn's disease, which are known as malabsorption diseases, then that might also be a factor that is making it difficult for you to absorb calcium. This can also happen if the body is excessively removing calcium. And one of the ways that happens is if we have like kidney disease, right? Like the kidneys are not functioning well. Or if we have wounds, especially in the gastrointestinal areas. So a gastrointestinal wound is going to really cause us to lose a lot of electrolytes in general, and calcium is included in that. Or you might have good old fashioned diarrhea. So definitely diarrhea is going to cause you to lose a lot of electrolytes, calcium included. In some cases, you might have great absorption. You're eating enough calcium containing foods, your body's absorbing it right, but there's a lack of ionizing calcium in the blood, right? And when we talk about ionized calcium, we're talking about free calcium, right? And let me just explain that, because it's important to know that there might be different forms of calcium in your blood, right? So calcium in your blood might be bind to like albumin or other proteins, or bind to other structures, right? So all the calcium in your blood is not free, but the free calcium, the ones that are not binded to anything, are known as ionized calcium, right? And some physicians will actually, when they get a serum calcium level that is low or high, they actually might want to look on the ionized calcium specifically to see what is going on there. Okay, now conditions that may cause you to have very low ionized or free calcium includes acute pancreatitis, if there's too much phosphorus in the blood, if we're having too much intake of calcium binders, if there's too much protein in the blood, okay, and if there's a malfunction, or if there's removal of the parathyroid hormones or parathyroid glands. Okay, so what is this going to look like? All right, so when we talk about signs and symptoms of low calcium, we're going to look specifically at the neuromuscular and the cardiovascular symptoms. Okay, now we know that there may be other symptoms, but the most pronounced symptoms of calcium overload or deficiency are going to be neuromuscular or cardiovascular. So neuromuscular symptoms that we will see for low calcium, you will notice that most of the neuromuscular symptoms speed up, while most of the cardiovascular symptoms slow down. So the skeletal muscles are going to be twitching. You're going to see tetany. You're going to see seizures. Definitely muscle spasms, especially in the calf muscles. Numbness, tingling of the lips, the ears, the nose. You're going to see that, and then you're going to see anxiety, irritability, hyperreflexia of the deep tendon reflexes, meaning that the reflexes just keep going. They don't stop, they just so they're overactive, in other words. All right. And then we're going to have the classic positive Trousseau's and Chvostek's sign. All right. So when we talk about positive Trousseau signs, we're talking about placing the blood pressure cuff on the hypocalcemic patient and inflating it over the level of the systolic where the systolic blood pressure would be, and then we're going to see that arm starting to tremble a lot, right? And then for Chvostek's, we're going to see a facial tick, right? When we tap on the cheek area right there. So just remember Chvostek's cheek, and then Trousseau's trembling of the hand, okay? And then we tap on that area, right? And I think that's the facial nerve gets irritated, so you'll see a tick right there, okay? All right, so the cheek just keeps like jumping, that kind of stuff, okay? Now, interestingly, as stated before, the cardiovascular symptoms really slow down. So the heart rate is going to be decreased. So heart rate decreases, you're going to have prolonged ST interval, and QT interval is also going to be prolonged. And when you take the patient's peripheral pulses, they'll be very weak or very diminished. Okay. So what do we do for these patients? All right. Well, number one, the first thing we're going to do, we're going to put them on a cardiac monitor. Why? We want to do that because we want to keep an eye on those ECG tracings. Okay. Two, if we haven't done so already, we want to give them some oral or IV calcium supplements. If you're going to do IV calcium supplements, you want to make sure that the bag or the solution is warmed to at least the body temperature before you give it. Okay. You also want to keep a frequent monitoring of the IV site, right? You want to frequently monitor the IV site if you're giving IV supplementation, because electrolytes can be very caustic or very hard on the veins. So you want to keep an eye on that frequently in order to assess for infiltration or phlebitis. Okay. Alrighty. And you want to give aluminum hydroxide or vitamin D for the client with low calcium, because these substances definitely help to absorb more calcium. All right. Reduce the environmental stimuli. Remember that the neuromuscular symptoms are just going. So you want to reduce the environmental stimuli. You probably want to turn the light off a little bit with these clients and shut the door. Okay. And initiate seizure precautions. Definitely. You want to also be careful because these clients may have a higher risk, or will definitely have a higher risk of pathological fractures. Okay. So moving these patients, from bed to chair or wherever you're moving them, you got to be careful, extra careful with these patients. Okay. And then lastly, you want to just keep some calcium, like for example 10% calcium gluconate, which you like on hand or within in the Pyxis medication room, in case you have a sharp fall, critical drop in potassium, in calcium I should say. Alrighty, let's jump into hypercalcemia, which is too much calcium in the blood. All right, so this is defined when there is greater than 10.0 milligrams per deciliter of calcium in the blood. So we say you're hypercalcemic at that point. Now, what is causing this? All right, the person may be ingesting too much calcium or ingesting too much calcium containing foods, right? May also be ingesting too much vitamin D or aluminum hydroxide, and those substances, as we said before, what they do, they increase the absorption, the rate of absorption or the amount of absorption, right? It makes calcium absorption go way more like efficient. All right, so over administering thiazide diuretics can also be a problem, because thiazide diuretics are potassium or calcium, sorry. Why am I thinking about potassium? I don't know. Over administering thiazide diuretics can be calcium sparing. Okay, so definitely that's going to cause us to have an excess of calcium if you do that too much. All right, too much parathyroid hormone may also cause the increase in calcium levels. Now, PTH or parathyroid hormones indicates to the bones that they kind of need to release some calcium that they have been storing, right? So the more parathyroid hormones we have been released, then the more calcium comes in the blood, and that's a problem in the hypercalcemic patient. Too much thyroid hormones, right, can also be a culprit, or even a tumor, like for malignancy, right? So for parathyroid hormones, they could definitely be a tumor that is causing the over release or excessive release of PTH as well. All right. And lastly, the overuse of glucocorticoids, which are steroids, right? So prednisolone, dexamethasone, hydrocortisone, those are all glucocorticoids. Okay, now to the signs and symptoms of the patient that has too much calcium in the blood. Now, as we said before, we look on neuromuscular symptoms, and we look at cardiovascular symptoms, right? Now, the opposite happens for hypercalcemia, where your neuromuscular symptoms are going to slow. They're going to slow down, right, for the skeletal muscle, but the heart or the cardiovascular symptoms are going to speed up. So, for the hypercalcemic patient, you're going to see profound muscle weakness. You're going to see diminished deep tendon reflexes, fatigue, lethargy. You're going to see the respirations being so slow. They're going to probably be ineffective as well because of the profound muscle weakness. Okay. Sorry. Now, for cardiovascular symptoms, what you're going to see is an increase in blood pressure. The pulses, the peripheral pulses are going to be bounding, okay? Bounding peripheral pulses. And in terms of EKG tracings, you're going to see shortened ST segments and widened T wave segments. And I'm just going to just quickly explain why that is, because in the heart, you have L type and I think T type calcium channels, and these really go towards the they're dromotopes, because they increase the strength of the heart rate, and they also chronotropes, they increase the speed. Okay, so this is why you're having that. When there's a lot of calcium, there's more available to these channels, L-type channels and T-type channels of the heart, and so the heart beats faster, okay, and stronger. All right, now what are we going to be doing for these patients, right? What are the interventions? Number one, again, we want to place these patients on a cardiac monitor, right? Why? Again, we want to monitor the EKG tracings, right? If you have IV calcium going, or if you're giving oral calcium, you need to stop, right? Discontinue that right away. Also, discontinue any vitamin D on aluminum hydroxide. We want to stop all of those. Give medications that stops the breakdown of the bone to put more calcium in the serum, right? So you know how I said how PTH promotes that breakdown of the bone, meaning the stored calcium to come out into the serum. Now calcitonin actually does the opposite of PTH. So calcitonin signals to the bone to stop doing that. Okay. Other drugs that does the same thing, aspirin and phosphorus also is going to lower the amount of calcium in the blood, okay, or bisphosphonates. Now we want to also prepare this client for dialysis if there is a critical high. Okay, so the critical high and it's an acute situation, we might just need to carry this patient to dialysis have them dialyzed right away, because we probably fear that we might not have enough time to do the other interventions. Okay, now remember also to move these patients very carefully, because they are at very high risk for pathological fractures. Their bones can really break any minute. And in addition to that, I also want you to really remember that these patients are at high risk for kidney stones and gallstones, right? So what you want to do, you want to definitely strain the urine for any to see if your patient is getting any kidney stones, and you also want to monitor the patient for abdominal pain to see if that may be as a result of gallstones. All right, now that's the end of this lecture. Catch me in the next episode.